why your home health agency could lose $500K in the next audit, and how to prevent it. You're billing compliantly, following the rules, doing everything right. Then Medicare shows up with an audit notice, and suddenly you're staring down the barrel of a six-figure repayment demand. In the next 5 minutes, I'm going to walk you through exactly what a home health billing audit involves, the documentation traps that destroy cash flow, and the 3 critical systems you need in place to protect your agency's revenue before auditors come knocking. Most home health agencies don't realize they're vulnerable until it's too late. By the time you finish this video, you'll know exactly where your agency might be exposed and what to do about it. So here's what happens when Medicare decides to audit your claims. They're not just checking boxes on a form. They're examining whether you properly documented medical necessity, followed certification requirements, and billed services according to strict regulatory guidelines. And the financial stakes? We're talking immediate cash flow disruptions, mandatory repayments, and ongoing monitoring that can impact your operations for years. Let me be clear about something. An audit isn't just an inconvenience. It's a critical test of whether your revenue cycle management systems can actually protect your agency when it matters most. Now, not all audits are created equal, and understanding the difference could save your agency hundreds of thousands of dollars. Let's break down the 3 types you need to know about. First up, RAC Audits. Recovery Audit Contractor reviews are the most common and potentially the most damaging type of home health billing audit you'll face. These are post-payment reviews specifically designed to identify overpayments and claw money back from your agency. When RAC auditors request medical records for specific episodes, they're analyzing your documentation against Medicare coverage criteria. And here's the kicker. You typically have about 60 days of disrupted cash flow while you're scrambling to respond to these comprehensive reviews. Then you've got MAC audits. Medicare Administrative Contractors focus on prepayment review, which means they hold your claims and scrutinize them before you ever see a dime. You're providing services, paying staff, keeping operations running, but your money is just sitting there in limbo. What starts as a few questioned claims can quickly evolve into a comprehensive review affecting your entire revenue stream. And the most serious? OIG Investigations. The Office of Inspector General doesn't show up for small issues. These audits are triggered by whistleblower complaints, unusual billing patterns, or previous audit findings. We're talking comprehensive reviews that examine not just individual claims, but systemic issues with your documentation, certification processes, and billing practices. Recent OIG reports on home health agencies have resulted in compliance findings and financial penalties worth millions of dollars. Now here's where most agencies get into trouble. It's not about intentionally doing something wrong. It's about what does a home health billing audit involve in terms of documentation requirements, because this is where the money gets lost. Let's talk about physician certification first. This is the foundation for all Medicare reimbursement in home health billing. Auditors are verifying that certifying physicians have sufficient documentation in their records to support the need for home health services. They're checking that face-to-face encounters occurred when required. They're examining plans of care to ensure they contain all mandatory elements. And when they find systematic certification problems, they don't just deny individual claims, they question entire episodes of care, potentially creating repayment obligations worth hundreds of thousands of dollars. Think about that for a second. One documentation gap in your certification process could unravel months of revenue. Then there's OASIS assessments. Auditors scrutinize these with a particular focus on how your functional and clinical scores support the medical necessity and level of services you've billed. If your documentation doesn't clearly link OASIS scores to service provision, you're looking at significant claim recoupments. The complexity here is real. Seemingly minor documentation gaps can result in major audit findings. And your clinical notes? They're examining whether these notes support the frequency, duration, and type of services you billed. They want specific documentation that demonstrates skilled nursing or therapy services were actually provided as claimed and that services align with the established plan of care. Here's what makes this so dangerous. Inadequate clinical documentation doesn't just result in individual claim denials. It establishes patterns of non-compliance that trigger ongoing audit monitoring and heightened scrutiny of your future claims. You're not just losing money today, you're putting yourself under a microscope for years to come. But the documentation issues are just the beginning. Let's talk about what happens to your cash flow when an audit hits. When auditors identify potential billing irregularities, Medicare contractors often implement immediate payment suspensions. We're not talking about just the claims under review. These suspensions can extend to all new claims, creating operational cash flow crises. You're still providing services, still paying staff, still running your agency, but you're receiving zero reimbursement. For agencies operating on typical 30 to 60-day payment cycles, extended holds can create insurmountable financial pressure. And when audit findings come back against you, those repayments are collected through automatic deductions from your future Medicare payments. These recoupments can represent months or even years of accumulated overpayments, creating long-term cash flow challenges that affect your ability to operate and grow. Here's something most agencies don't factor in. The hidden cost of audits isn't just the money you have to pay back. It's the administrative burden. Your staff is spending time responding to audit requests, gathering documentation, managing correspondence, all while trying to maintain current billing operations. These operational disruptions often result in delayed billing submissions for current patients, creating secondary cash flow impacts that extend the financial damage way beyond the original audit scope. So what separates agencies that weather audits successfully from those that don't? 3 critical systems. First, proactive documentation and compliance monitoring. You need systematic documentation review processes that identify potential audit risks before they become actual findings. This means regular review of physician certifications, OASIS assessments, and clinical documentation to ensure compliance with evolving Medicare requirements. Agencies that wait for auditors to show up discover problems when it's too late to do anything but write checks. Second, data-driven audit response strategy. When audit requests come in, you need systems to quickly locate required documentation, analyze billing patterns, and prepare comprehensive responses that demonstrate compliance. The difference between random audit response and strategic audit management often determines whether you face minimal findings or significant recoupments. What does a home health billing audit involve in terms of response? It requires audit-ready documentation systems and the ability to quickly compile the comprehensive records that auditors demand. And third, revenue recovery and appeals management. When audit findings do occur, you need the expertise to evaluate which findings warrant appeal and the knowledge to present compelling cases for revenue recovery. Many agencies attempt to handle this internally, only to discover that inadequate appeals result in permanent revenue loss that could have been recovered with proper expertise. Here's the bottom line. Treating audit readiness as an ongoing operational requirement, not a reactive response, is what protects your revenue. You need billing operations designed with compliance built in, not bolted on after the fact. The agencies that successfully navigate audits are those with systematic compliance infrastructure, integration of operational experience with data analytics, and ongoing monitoring systems that identify risks before they become findings. Understanding what a home health billing audit involves isn't just about knowing the process, it's about recognizing that with potentially hundreds of thousands of dollars or more in revenue at risk, you need billing expertise specifically designed for the unique challenges of home health service delivery. You can't afford to treat audit readiness as an afterthought. The complexity of compliance requirements, the financial impact of audit findings, and the operational disruption of audit responses demand a level of expertise that goes beyond basic billing services. If you want to see exactly where your agency might be vulnerable to audit findings and revenue loss right now, reach out to us. We'll analyze your specific billing patterns and compliance risk areas to show you how a data-driven approach can protect your revenue before the next audit notice arrives. If this video helped you understand what's at stake with home health billing audits, hit that subscribe button so you don't miss our next video on protecting your agency's revenue. Drop a comment below if you've dealt with an audit before and tell us what your biggest challenge was. And if you know another home health agency owner who needs to hear this, share this video with them. They'll thank you later.